Hello, and thank you for joining me. I'm Dr. Michel Akkad, Medical Director of Athletic Heart of San Francisco. The tagline on our website says, Direct Cardiac Care. What does direct care mean? And why do I think that the direct care movement is such a hopeful trend in medicine today? Let me illustrate with an example. Recently, a young man called the office wanting to be seen. I spoke with him on the phone for a few minutes to better understand his concerns and plan for his visit. It turned out that his girlfriend had been hearing a whooshing sound. Whenever she would lean her head on his chest, she would hear a pulsating whoosh, whoosh, whoosh. So obviously there was a concern that this had something to do with the heart. He was otherwise feeling well. He had no problem exercising. A few days later, he came to the office, and in the span of a couple of hours, I gave him a full consultation, and we did an EKG, a cardiac echo, which is an ultrasound test of the heart, and a treadmill stress test. At the end of that, I was able to give him a firm diagnosis. One of his heart valve was leaking severely, and I was able to give him a treatment plan. The valve, I knew it on the basis of the tests that we had done, that his valve, for the time being, does not need any intervention or any surgery. It just needs to be monitored over time. I was able to educate him, answer his questions, tell him about the prognosis, and so forth. This is direct care. Now, let's contrast this with what we might reasonably expect to happen if he had gone through the usual channels. Under the usual care, he would first have had to see a primary care physician. If he had an established relationship with the primary care physician, it might take just a couple of days to get seen. But if not, if he didn't have any primary care physician, it would take 3 to 4 weeks perhaps before getting an appointment as a new patient. After that, presumably the primary care physician would, hear the murmur and then refer him to a specialist and probably order some cardiac tests ahead of the specialist's visit. Now, in San Francisco, I know that to see a cardiologist takes at least 3 to 4 weeks for non-urgent new consultation, but sometimes a lot more. I have colleagues who have waiting times of 3 months before they can see a new patient. They are so busy. And I think it's not unique to San Francisco. I think it's the case around the country. So I think it's fair to say that he would not see a cardiologist for at least 4 to 6 weeks. And then if the tests had not been properly ordered by the primary care physician, if additional tests were needed, then the cardiologist would have to order these, and it would take another 2 to 3 weeks before the patient could get finally a firm diagnosis and a treatment plan. So I think it's reasonable to expect that in the usual system it would take, maybe 6 weeks to 2 months and possibly more. Now let's talk about the financial aspect. In the usual care, if the patient has insurance, he would be billed for the primary care visit, for all the tests, and then for at least a cardiology consultation and possibly a cardiology follow-up after all the tests are completed. I think it's reasonable to expect that at a minimum, the bill to the insurance company would be $2,000 and possibly more. I have seen cardiac echoes by themselves be billed for $2,000 or $3,000 to the insurance companies, just the cardiac echo by itself. So I think it's reasonable to expect $2,000 to $3,000 and possibly more. Now, if the patient has a high deductible insurance, which increasingly more and more Americans have, as their insurance plan, a plan that involves a high deductible, then he'd be on the hook for the entire deductible, and it might be $1,500, it might be $2,000, it might be $3,000, it might be $5,000. It could potentially be very ruinous. And if the patient does not have any insurance, which can happen, then it could be really catastrophic. Now, contrast that with the cardiac care. At the end of my visit, at the end of the 2 hours, he was billed $875 for the consultation and for all the tests. Not only that, but he knew exactly how much it would cost before even coming. He knew it because when we spoke on the phone before his visit, I could anticipate what would be needed. And then all our fees are posted on our website and they're transparent and people know exactly what they're getting. This is direct care. And it's not just this particular patient. All the patients who come to Athletic Heart of San Francisco get a similar treatment. They get a timely answer for a reasonable fee that is, posted and they're aware of it ahead of time. And it's not just my clinic. The direct care movement is a movement that is actually growing across the country. It is booming among primary care physicians, where it's called direct primary care. And these are physicians who are very competent and who say, enough is enough of the nonsense of all the paperwork that we have to fill out and all the insurance claims that we have to deal with and so forth. We want to deal with patients directly. We're going to do this at a very affordable fee. and we're going to be available to the patient. It's going to be timely. It's going to be high quality. We can also provide to our patients medications that we can purchase at wholesale costs. You know, we can do this in certain states, not every state, but in many states, doctors are able to do that. We can provide lab tests at a discounted fee, and this is going to be very reasonable and very affordable, and it's booming, and it's called the direct primary care movement. Direct care is also growing among specialists, such as surgeons, who say, you know, also enough of the nonsense. We can provide elective surgeries, so long as they're not emergency surgeries. We can provide them on an outpatient basis, and we can do this whether it's a knee surgery or an ENT surgery or any kind of surgery of that sort. We can do this for a flat fee. The patients will be aware of what the fee is ahead of time, and the fee will cost a fraction of what is normally charged through the regular insurance system. So this is the direct care movement, and I think it's very hopeful and it's growing, but it deserves to be known more widely. So if you found this helpful, please share the video with others. And at the end of, actually in the comment section of the YouTube and also on my blog post, I will have links where you can get more information about the direct care movement, whether it's direct primary care or whether it's direct care to specialists. You will find those links very helpful. And I will link also to our own direct primary care clinic, which we are starting here in my office. I practice internal medicine as well as cardiology, and I offer direct primary care to the residents of the San Francisco Bay Area. So thank you very much for joining me. Please share this widely, and I will see you next time.